At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna Cryer. I'm the founder and CEO of the Global Liver Institute, and I have the privilege of being your host for this episode of GLI Live. This is a really special episode for so many reasons. The first of which, of course, it's Donate Life Month. So as someone who has received the gift of life, the miracle of organ donation and transplantation, this is month and certainly every month that I've been able to experience since in almost 30 years since my transplant is very special. But today I also get to share with you a guest who has been instrumental in making sure that other patients coming behind me also have access to the innovation and the miracle that organ donation and transplantation is. It doesn't just happen by accident. It's a very complex system that many people work hard to make sure that it serves as many Americans as possible. And one of the hardest working people is someone that you probably didn't even know even existed. Melissa Dickerson is senior investigator for the Senate Finance Committee. Did you even know that they had senior investigators at the Senate Finance Committee, let alone people who have nursing backgrounds, who are my favorite people, of course. And so to tell us more about what that role entails and how the Senate Finance Committee was instrumental in working with advocacy to make sure that our transplant system was modernized and is serving as many people as possible, I give you Melissa Dickerson. Welcome.
Well, thank you so much, Donna. That was such a nice introduction. I'm so excited to be with you all today. And I think this is just great that you all do these type of events. And I'm just really looking forward to this.
Excellent. So how does let me just even start. How did you come to work with the Senate Finance Committee?
That is a great question. I had spent years of my career at the bedside doing emergency room nursing and ICU nursing, but I'd always had an interest in policy. And when I was considering grad school, decided, hey, this could be something I could potentially do with my nursing career. And ended up going to get my master's in public health, where I focused on health policy. Landed an internship with the committee while I was in grad school, still working as a nurse, and then just kind of worked my way up through that office and took opportunities where they came. I honestly had never really understood or was fully aware of the oversight aspect of Congress. One of my predecessors kind of described it to me as, you're telling the story of why legislation needs to happen. You're finding the facts, you're making the case. And you're finding the problems that need to be fixed. And I found that really appealing. And I think given the committee's, work with Medicare or jurisdiction with Medicare and Medicaid, having my nursing experience was a plus because I understood a lot of these issues in a very different way. And I think that was partially a lot of what I could bring to this investigation too. So yeah, it kind of happened that way, and I wouldn't look back and change it a bit.
So we are so grateful for that. It's always exciting when we go to the Hill as a patient advocate, and we meet somebody from a healthcare background who understands the context of the the problems and challenges that we're trying to fix. So thank you for taking on that role. So how did the Senate Finance Committee become involved in the issue of organ donation and transplantation?
Yes, this is one of those issues where it's tricky because I'm not sure if people listening are familiar with the term jurisdiction, But this is one of those issues that has split jurisdictions, which means multiple committees oversee multiple parts of it, which makes making changes very difficult because you need lots of people on board to do those changes. Our jurisdictional hook is through Medicare and Medicaid as payers of transplant, but also as the certifiers of organ procurement organizations and transplant centers, which is a very powerful kind of lever to be able to use as the Medicare lever. And additionally, kidney transplants, and we pay for dialysis. So it's, there's a lot of factors. But our committee oversees the CMS side of things. And then the Health, Education, Labor, and Pensions Committee oversees the actual organ procurement transplantation network and the contractor that oversees it, which obviously has a lot of spillover effect onto our committee's, role here. So that was a big reason for us getting involved, was that kind of hook, but also, Senator Grassley, when he was still chair, gosh, this time has flown over these last few years, but back in 2020, before COVID, actually, when he was still the chair, they had started this investigation and asked us as ranking member to join on. We said, absolutely. But he has really, over the years, paid attention to the kind of organ procurement side of this and, requested different reports from GAO. And I think, their team really saw this as like an important one for him to look into while he was chair. And, as we kind of passed and, leadership roles changed over the election, we said, we got to keep doing this. This is too important to let it slip between Congresses, and continued working with them and continued working on it with them for many years, actually, because it was not a simple solution. It was not a simple find. And so it took a lot of time, but we continued carrying the torch after he left the chairmanship.
So I think you made several important points that I want our listeners, our watchers to pick up on. One is that things take time. And so, we talk about doing actions at the pace of patient need, which sometimes is very urgent. And so the fact that the legislative process often takes time, particularly when you're looking at something complex and you need to sort of bring all the facts to the table. And so, one of the things I explain to our advocates is often, things take time. They don't just sort of suddenly emerge, but they're worth doing. The other thing is that this is such a wonderful example of bipartisanship. Because everybody, Republican or Democrat, has a transplant center in their district or has someone who needs some type of transplant. And so as a global organization, even when I've gone to Europe, I've given this as an example of our government is working. People can come together and work on important issues. And frankly, it's given our European allies a lot of confidence, in the country again, that we can in fact do good work together, because that's too often not the message that anyone is getting inside the country or outside. And so maybe talk about how, both sides, all sides came together and worked together on this issue.
Sure. Yeah. So I think this is like a benefit of using oversight to kind of help find a solution and help bring, a fix to the problem. Because the best oversight we do is when it's bipartisan oversight, because you're finding the same facts, you're all seeing the same problems, and you're all kind of on the same page, like, hey, we need to fix this. And I think because we started this in a bipartisan manner and really continued the work very much like through every letter we sent, every, question we asked to CMS, question to HRSA, we really did try to stay aligned, because it is very hard to get things done when it becomes partisan and it starts to get viewed in another light. And so I think that was a big aspect, starting in the oversight lens, because we already had that bipartisan foundation and like the bipartisan solutions we came to together. And I think also, to your point, reminding people and this is just in general with many issues in the healthcare space, why this is beyond parties. This is about people. This is about patients. This is about lives. Like, this is not something we can all just sit on the sideline and not do anything about. Like, we found the problems. We can't just sit on these problems and let them fester. And so I think, reminding people like why this does matter to everybody and why it doesn't just matter to a certain group or a certain group or a certain group, I think was really powerful with this work too.
And so your work ultimately resulted in an actual bill and action, but your initial work produced a robust 66-page report entitled "A System in Need of Repair," addressing organizational failures of the U.S. Organ Procurement and Transplantation Network. So what were some of the major takeaways from the report? What were some of the things that really sort of shocked you and the members of Congress to learn?
Yeah, so that report was the reflection of the years that I had talked about of questioning and working with the current contractor who, we went through a lot of documents to get to the findings that we did. We found, lots of examples of patient safety concerns was a big one. Whether it was like a process failure or a blood typing issue or a different testing error. There was one example we found where a patient had been transplanted with an organ that had cancer in it and didn't find out till after the fact. There was also different transportation failures, which, wasn't necessarily a policy violation. So not really being taken care of seriously. So those were kind of like the buckets of like the problems we found. But another big one too, is that there really wasn't a lot of oversight from the contractor and holding the actual organ procurement organizations accountable. I think, I looked back at this earlier today, like 60% of the cases that people actually submitted, like a complaint to the contractor, only 40% of them actually made it through to the MPSC, which was the group that oversees and like addresses the complaints.
Right. The Membership and Professional Standards Committee.
Exactly.
Yeah.
And I think patients realize like, hey, only 60% of the complaints are going through, that's something people need to know. Right. And obviously there's a method for going through and figuring out what needs to rise to the level of the MPSC. But even once it got to that level, you just get a letter, which essentially is a slap on the wrist. Right. And very few of the organ procurement organizations actually saw anything more serious than that. And even the ones that did, none of them, you know this, Donna, none of them have ever lost their certification. So it's like they just kept operating. And so I think that was really glaringly like a big takeaway for us was like, wow, there is really not a lot of accountability here. And they're really like not holding each other accountable or anybody accountable for these problems. And then I think also just like the technology issues, we had been able to obtain a report from the U.S. Digital Service that was not public at the time that we released alongside our report. And it was pretty concerning what they had found with the technology that runs the whole waiting list. And in terms of, out of date, security, just not being a great system. And that's such a core of the transplant system is the waiting list, how it functions. So those were kind of like a big takeaways from it. And like the real key thing we realized from this was like, wow, we need more competition in this space because the same contractor has been there for the last 40 years. Right. And there's essentially no one else who can apply for this as the way that the law is written. So we need to do something. Right. And that's kind of how we got to the solution that we did of like, we need to let HRSA be able to give multiple parts of this to multiple entities because it's not working the way that it's designed.
So I loved that. I just want to repeat that it's 40 years, 40, yes. Not in case anybody, just thought, oh, that must be 4 years. So there has been the same contractor. No, 40 in the entirety of the legislation. There had just been this one contractor. And, as I've I've served on membership professional standards. I've been on this committee. I've been to the, new big shiny building in the, Richmond Biotech Park. And so it was so important, this work, that many advocates, many of us have been, as you pointed out, making complaints, but only a small portion of those complaints make it in, and then a small portion of those are even sort of seen or given visibility and dealt with. So the fact that your Senate committee pulled together all that information, and got visibility for all of those issues that had been raised or were known in different pockets, and not only shone a spotlight on the problem, but then worked towards solutions, is just really so powerful. And as the patients and families who rely on the system, they rely on us to do this on their behalf, so that they can deal with the even harder parts of taking care of their family members and making it through their health issues. And so we worked to make it visible, to be able to give it to somebody who would actually make the change. Is just I won't cry, even though this is allergy season. I could blame it on the allergies, but it's such a powerful thing. I can't even express my gratitude for the partnership that you and all the members of the committee have shown to the patient advocacy community, and to us, to see us, to care about us, to listen to us, and then to actually make change, all the way to the president's office, where I got to be part of a bill signing. And so between the time of the bill signing, and then HRSA implementing it, we are still we are still working with them. And so what can people hope to see in the future? So it's not as if sort of the movie fades out on a happy bill signing, and then all is done, all is great. Does the committee still stay involved in making sure that the legislation is working as intended, or do you just move on to another issue?
No, we absolutely are paying attention to everything that has been happening over these last few months. Well, not few months anymore. Time is really flying by. It's already March, but no, in all seriousness, I think everybody is like, oh, when a bill happens, like, your work is done. And it's, as I was reminded by my boss, Chairman Wyden, when he gave me a gift of the signed bill, your work is just starting. We got to oversee this. We got to make sure it's done right. And so, that's kind of the next step, is making sure that everyone's voices are heard, paying attention to the questions being asked, getting answers. And, like you said a little while ago, Donna, this is the first time any of this has changed in 4 decades. And I think that the whole community is a little bit, like, oh, like, this is a lot of change. And so I think really, paying attention to what's going on, working through it, raising up concerns, continuing to oversee HRSA is very much top of priority for us, to make sure that this all, gets rolled out as it should be.
Absolutely. One of the issues that, or one of the functions of the Global Liver Institute, is to make sure that there is a connection between the policy issues and the opportunities for comment and engagement by the public, by patients, by their families, are easier to make. I am, I've been in Washington, D.C. Since I graduated from college and went to law school here, and have worked in policy issues for, almost that entire time. And so, a lot of information just sort of comes to me because people know that I am interested in certain issues. But as we, thought about how do we make sure that there is opportunities for input from people outside of DC, from all around the country, in all of the districts that the members of your committee serve in and beyond. We put together a liver health policy update, and it's so much more than liver. I know that our kidney friends use it and pass it along. But one of the outcomes of this has been that more patients have been contributing to comments about how the transplant system should work, stories and comments about their experience with organ donation. There open, there have been listening sessions, there have been comment periods open from from HRSA on all of these steps. So I want to encourage people to continue to share their voices and their experience and their comments on every step of the process, that their thoughts are welcome. And people read these comments. I stay up late at night, read these comments. I know you stay up at night and read these comments and think about how we can do this better. And so part of this whole exercise is letting people know that they do have a voice in this, and the voices are listened to, and to continue having, engagement on these issues that affect so many people. And so that continues. And so I want that message to penetrate with people, that it it's not like, okay, we heard you, we've done this, and you can go away. Like, we need everybody's voices to still keep making sure that the process, proceeds. And then feedback on, we've made a lot of change, as you said, are these changes having unintended consequences? Are they enough? Do we need to, amend that? Or, we have increased competition. Is it the right type? Or how are the, new people who come into the space where, we want to make sure that they're doing the right things. And so we need people to keep staying engaged in this process as it moves along.
And just one thing I'll add to that, Donna, I think it always surprises me when I just, talk to people in general places in advocacy. When you call your, member, your senator, people answer those calls. People take those notes. They I always try to encourage people, it might take getting through to the right person. It might take a couple tries. It might take a follow-up email here and there. But, that's what your members are there for. And they listen to their constituents. I know my boss in particular really everything is always in, well, what do Oregonians think about it too? Like, he's always got that in his mind. And so I think just to encourage people, it might seem like, oh, you just got a voicemail or something, but, call the number back, or, send an email, and people, they will, someone is receiving it on the other end.
Absolutely. So, we're in territory that wasn't covered by Schoolhouse Rock, as we were talking before, and so, what are some of the best ways that people can present information? We talked about some of the methods, email and texting, but what is most helpful to you in being able to do your job when somebody's doing their Hill visit? How can they best prepare to really help you do their job? Is it, telling a story, or bringing data, or having something, local to add on? What gives you the best opportunity to make the type of change that people are asking for?
That's a great question. And I think it really depends on what you are asking for as an advocate. I think a lot of the times those personal stories are incredibly important, because they remind people, this is why we're doing this, and this is why my group is here, and this is why this matters, because you're drinking through a fire hose in these Hill offices, and you are constantly bombarded with information. And so I think letting people really take a moment and be like, wow, this is this matters. Like I hear it. So I think those personal stories are very important. I think if there are things that you're bringing to people that you have a solution for them, or it's a bit of a complicated issue, I think sometimes just helping someone do a little bit of their homework actually goes a long way, because if you're like, this is my problem, I'm bringing it to you, but it's an issue that you've not met with this office about before, or the staffer isn't really that familiar with it, they're just kind of like looking at this like as like, I'm like not quite understanding like what's going on here. And so I think sometimes just like, putting even points together of like, this has been the history of this issue, and this is what's happened over this last year in Congress. Even like some people who, follow certain issues very closely are going to know those things, but some might not. And so I think sometimes just helping educate like a staffer is to like, here's the context, here's the history, this is why it's important. That helps a lot too. And then I think, always bringing it back to like, this is, to your point of like, just being like a local thing help like, bringing it back to kind of like, if you're meeting with a member from your state, why this matters as a constituent, I think is also really important.
I think that, thank you for that. As we train advocates through our Advanced Advocacy Academy, we've touched on a lot of the things that we work with patients to, one, understand what the jurisdiction or the scope or the power is of the particular entity that they're meeting with, so that the ask is something that is possible to do. I call it sort of reality-based advocacy. Like, is it even possible to do that?
That's a great phrase.
and thank you. And so and then what is needed? So certainly a personal story, but effective advocacy is backed by data, and many patient advocacy organizations, like, we don't have an economist on staff. We don't have, often big data, machinery. And so the partnerships that we can, make with universities or others to encourage them to do research into our problems, and to talk with media to take the stories to the next level. And so I think that when I look back on sort of teaching this as a case study in advocacy, and thinking about all the tools that were deployed to enable this to happen, it was so multifaceted, and the ability for patient advocacy organizations to have these partnerships to help, you and your investigative work to sort of to build the case, to really paint the issue fairly and fully, was a reason that this could be done and successful, when sometimes other changes, aren't made, even when, they may be equally as valid. And so just as we close, maybe just a message to future advocates, or even future nurses who are thinking about being in policy, on what you've learned, and what you valued, and what your takeaways from this process has been, even though it's continuing, but what has been sort of probably the most important lessons from the success.
Ooh, that is a great question to end on. One big one that always sticks out to me through this whole process is, because someone said it to me as we were kind of going through all of this, was, you never know until you ask. You never know until you actually try to do something. Don't just assume something is no. Don't just assume you can't do it. And I think a lot of this work, we just kind of kept pushing through and kept asking, can we do this? Can we do that? How about this? How about that? When you met a roadblock, okay, pivot, let's try something else. So, until you get that final door closed, don't just assume that you can't open it. And that goes professionally for any nurses out there who are thinking of different career tracks, but also just, in legislatively as well. And I think another big thing I've taken away from this is really like relationships with, the groups who know these issues well, like really building those relationships. For me personally, building relationships across the aisle with different offices in the House, not only in the Senate, really kind of leaning into those relationships too, and being there and helping each other out so that all of us can kind of get this across the finish line. This was never at any point just, oh, my office, this is our highway, like this is the way and this is the highway. It's like we all need to do this together. So I think really those relationships are important.
Absolutely. I think, people are, we're so surprised as I talked with them through the process that, I think they assumed that we would have great relationships with, with some of the Democratic, senators. And when I talked about, the relationships and the hard work of, Senator Young and Senator Langford, and then the questions of Senator Blackburn, and we have a big Tennessee part of our Liver Action Network, a big Oklahoma, section from our Liver Action Network, who were so, just felt so wonderful about their senator stepping up and talking on their issues. And really the fact that everyone came to the table quite literally by the time we came to the Senate Finance Committee testimony, but had been working and their staffs had been working, with us all along. I think, just gave such hope to patients and families around the country that there were people working on their behalf, that people that cared about them, deeply, and were willing to work together. And so I'm so excited to extend a message of hope coming out of Washington, D.C. and function and bipartisanship coming out of Washington, D.C. And I just want to thank you for being that beacon of hope and carrying that banner for all of us who depend on you and the United States Senate. So thank you, Melissa.
Well, we could not do it without groups like yours, Donna. We are only a piece of the puzzle. So thank you, to you and everything that Global Liver Institute has done to get us here. That hearing that you participated in this summer, that was a huge move the ball forward momentum. Hey, let's remember why we're all here. And so none of this could happen without you all as well. So thank you. From my team to yours also.
Excellent. All right. So everyone can find this show and more information about the reports that we referenced and this work and how you can be a part of organ donation and transplantation in our show notes on LinkedIn and Facebook and Instagram and all the socials and all the things. So thank you for paying attention today.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.